this is the sixth and the last video, that is Haematinics part 6 in the series of videos on the topic Haematinics. Now, as we all know, Haematinics are the substances required for the formation of RBCs. Now, in this video, we are going to discuss pharmacology of erythropoietin. Now, erythropoietin triggers or stimulates the formation of red blood cells. Now, it is advised that you go through my first video, that is Haematinics part 1, in order to understand process of erythropoiesis and the requirement of erythropoietin. Now, erythropoietin is a hormone produced by kidneys. It is produced by interstitial fibroblasts located in the peritubular capillary bed of renal cortex. So, refer to the schematic diagram. Erythropoietin released from the kidney stimulates a colony forming unit of the erythroid series, and stimulation of these colony forming unit results in the development of proerythroblast, and these proerythroblasts, they undergo division and differentiation a number of times, and finally they produce erythrocytes, and during the process there is also synthesis of hemoglobin. So, we can say that erythropoietin is required for the utilization of vitamin B12, folic acid and iron by the RBC precursors so that they develop into mature erythrocytes. So, erythropoietin stimulates proliferation of colony forming units of erythroid series responsible for the formation of erythrocytes. They also induce hemoglobin formation. That means they induce utilization of iron by the RBC precursors, and they also induce maturation of erythroblast. That means they are also required for the utilization of vitamin B12 and folic acid by the RBC's precursors. Erythropoietin releases reticulocytes in the circulation, and once these reticulocytes they are released in the circulation, they undergo maturation, and finally these reticulocytes they develop into mature erythrocytes or mature red blood cells. Now, this is a very important diagram. Now, let's understand regulation of RBC synthesis or regulation of the process of erythropoiesis by erythropoietin, or regulation of RBC synthesis by the feedback loop. Now, this is a blood vessel. This is the circulating blood. Now, if the levels of oxygen in the blood fall, so if there is fall in the blood oxygen, now the fall in the blood oxygen is termed as hypoxia. Low availability of oxygen is termed as hypoxia. Low concentration of oxygen in the blood is termed as hypoxemia. Now, fall in the levels of oxygen in the blood can be caused because of the high altitudes. It can be caused because of the carbon monoxide, or there can be a number of reasons which are responsible for fall in the blood oxygen. Now, fall in the blood oxygen is the stimulus. This fall in the blood oxygen stimulates interstitial fibroblast of the kidneys. So, fall in the blood oxygen stimulates the production cell. Fall in the oxygen level stimulates the kidney. Now, stimulation of kidney causes release of erythropoietin, that is the hormone. Now, this erythropoietin, it stimulates colony forming unit erythroid series which are found to be present in the red bone marrow. That is a target cell. So, erythropoietin stimulates colony forming unit of the erythroid series present in the red bone marrow, and stimulation of these colony forming units stimulates the process of erythropoiesis. So, these target cells they stimulate the action, they stimulate the process of erythropoiesis. Now, when there is stimulation of the process of erythropoiesis, there is increase in the production, or there is increase in the formation of mature RBCs. Now, once the number of RBCs increases, the blood oxygen level also improve. There is increase in the oxygen levels of the blood. So, this is how erythropoietin regulates the process of erythropoiesis. If there is fall in the blood oxygen level, there is increase in the synthesis of erythropoietin, and this erythropoietin increase the process of erythropoiesis. It increases the formation of RBCs, and since there is increase in the formation of RBCs, the blood oxygen level rises. Now let's talk about the erythropoietin preparation. It is a recombinant human erythropoietin, Epoetin alpha, Epoetin beta. These can be administered subcutaneous or intravenous. Plasma half-life is 6 to 10 hours and the duration of action is for several days. Now indications of erythropoietin preparations. Erythropoietin is indicated to be administered in anemia. In anemia caused because of the chronic renal failure. Now in chronic renal failure, because of the renal failure, there is fall in the production of erythropoietin, and the anemia occurs because of the reduced erythropoietin. So erythropoietin is indicated in anemia of chronic renal failure. Then it is indicated in anemia in AIDS patients treated with zerovodine. Then cancer chemotherapy induced anemia. Another indication of erythropoietin is the preoperative increased blood production. That means it can be used for increasing the production of RBCs in a person before surgery. So preoperative increased blood production. For autologous transfusion during surgery, that is, blood is collected from the patient before surgery and there is transfusion of the same blood to the patient when required during or after the surgery. So before the surgery, erythropoietin is administered to the patient to increase the production of RBCs, and these RBCs are collected. There is collection of blood from the patient, and the same blood is transfused back to the patient if required during the surgery or after the surgery. So erythropoietin is indicated in preoperative increased blood production for autologous transfusion during surgery. Now coming to the adverse effects. Now erythropoietin when administered can cause sudden increase in hematocrit. It can cause sudden increase in the blood viscosity and increase in the peripheral resistance due to very fast correction of anemia, and therefore the dose of erythropoietin should be properly titrated. So start with a small dose and gradually increase the dose. Otherwise, there is sudden increase in hematocrit, blood viscosity and peripheral resistance, and this all can result in increased risk of clot formation. Now because of the increase in the blood viscosity, there is more of the platelet aggregation, and that increases the risk of clot formation in arteriovenous shunts, especially in patients on dialysis, as erythropoietin is indicated in patients with anemia because of chronic renal failure. Secondly, because of increase in the peripheral resistance, there can be hypertensive episodes, and apart from this, again because of increase in the blood viscosity, because of the enhanced platelet aggregation, there are more chances of the formation of thrombus. So there can be serious thromboembolic events. Now let's talk about treatment with Epoetin. Only symptomatic patients, that is the patients with anemia, should be considered. Now hemoglobin level of these patients should not be more than 8 gram per deciliter, that is hemoglobin should either be 8 gram per deciliter or less than that. Now Epoetin should be administered at a dose of 25 to 100 units per kilogram subcutaneously or intravenously 3 times a week, and the maximum dose should not be more than 600 units per kilogram per week. And it is essential to start with a low dose and titrate upwards so that the hematocrit remains between 30 to 36% and hemoglobin should also remain between 10 to 11 gram per deciliter. So these are the conditions which should be monitored, which should be regulated while the patient is treated with Epoetin. So this is all about pharmacology of erythropoietin and Epoetin. If you find this video helpful, kindly like, subscribe and share this video. You can write your doubts in the comment section, and thanks for watching the video.